You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for patients with gum disease. No more bleeding gums, according to my first guest. With us, we have an expert on the topic, Dr. Milici. Dr. Milici, welcome to the program.
Hi, Randy. Thank you.
Now, before we get into today's topic, and I have a lot of questions about this because you have a lot of good news, you say.
Yes, absolutely.
Tell me a little bit about your practice. I mean, who's the typical patient? What are the different procedures you do? And I guess you work with your husband.
I do. It's a unique situation. I work with my husband, Frank Matarazzo, and we treat all sorts of patients. We don't really have a typical patient. We see patients that require all sorts of dentistry.
Now, you're a specialist, both of you. Is that right? Periodontist.
And prosthodontist.
And prosthodontist.
Yes.
But you do, I mean, like fillings? You do everything?
We do cosmetic fillings. We do general dentistry. We treat adult orthodontics with Invisalign.
All right.
We take care of gummy smiles. For a patient who shows too much gum when they're smiling, we can trim back the gum tissues.
Do you laser that off?
We laser that off.
So you do porcelain veneers?
Absolutely.
All of those things. So let's talk a little bit about your background and training. You're a periodontist, right? And also a prosthetist. So what is a periodontist? You're a specialist.
Yes, I'm a specialist. So I basically treat gum disease, all sorts of gum disease. And through my training, also having a background in prosthodontics, I have more of an insight of how the restoration will look after the gums are taken care of.
Okay, so I get this right. Now, normally a periodontist just takes care of the gums, maybe does some implant surgery, and they send out to a general dentist to make the teeth look good, to put the crowns on, right?
That's correct. That's what's normally done.
Your training is both. Do I have that right?
Yes, and what's unique about
that is unique, right?
Yes, it's very unique, and that's what's so nice about working with my husband is that we tend to take care of these cases together.
So let's begin with defining gum disease. What is it? What are the symptoms, I should say? How does somebody know watching this that they have gum disease? Maybe their partner has gum disease.
Well, if they were to smile in the mirror and they saw, red puffy gums or swollen gums.
Puffy.
Yes, gum tissue should be a nice light pink color around the tooth, firm.
But if it's puffy, what's going on?
Well, there's lots of bacteria underneath the gum tissue that's causing inflammation.
Okay.
And that inflammation will also cause bleeding. So if they're flossing their teeth or brushing their teeth, they'll get bleeding on the floss. They may
a little bit of blood is okay?
Well, no, gum should not bleed at all.
Really?
So no bleeding is healthy. They also may have a bad taste in their mouth. So they may, taste the bacteria, the dead bacteria that's living under the gum tissue and think that gargling with Listerine or a mouthwash is going to help when it really won't.
But the bleeding part, help me understand, why is that gum disease?
When you have bleeding gums, Randy, it's really a wound. It's a cut in your mouth. So bacteria is traveling throughout your bloodstream. So all that bacteria that's underneath the gum tissue that you're not removing by proper hygiene or by having healthy gums is affecting your body.
Okay, so the laser, but how does the laser stop that bleeding? That's the part I'm not getting.
Well, the laser is actually killing the bacteria that's causing the bleeding.
Interesting.
So just by using the laser around the mouth in a couple of visits, we can start to heal disease.
Okay, so puffy gums we talk about, that's gum disease. So
Yes.
if you have red puffy gums, bleeding gums,
Bleeding
that's
gums.
what's another symptom of gum disease?
Well, another type of gum disease is gum recession, where the gum tissue is receding away from the crown of the tooth. So, and that could be caused from overzealous brushing or from grinding and clenching. So that's another type of disease.
If people do nothing with those receding gums, okay, what happens?
They're losing not only gum tissue, but they're losing the bone that supports the tooth. So ultimately, tooth loss will occur.
Okay, so people with puffy gums, red gums, bleeding gums, all of these things, what's the treatment options? What have they been? And then what are the new breakthroughs?
Well, previously, gum disease was treated in phases with, let's say, starting with scaling and root planing to try to get some initial healing. And then if the disease was not arrested, we would do surgery. We'd cut the gums, pull the gums
like cutting
back,
it out, cutting this infection out.
Cutting the disease out. But what we would leave was exposed roots. So patients would have long teeth, sensitive teeth now. So now, instead of doing that, we're using the laser.
And your job as a specialist, though, and I want to get this right, that when somebody comes to you with gum disease, that's a surgical procedure.
Yes.
Okay. Very painful? as well?
Traditionally?
Traditional.
Oh, traditional surgery. Well, during the procedure, no, because the patient's numb, but post-operatively, you know, it is very uncomfortable, and patients are left with sensitive roots.
So when you first started using the laser, okay, used to surgery, now you're doing the laser, what were your initial results?
Well, initially, Randy, you know, I was very skeptical, but through all of my training with the laser, I really believed in it. And so after I did my first set of patients, I would go back in and probe, and I would have, very deep probings, 9, 10 millimeters, shrink down to a 2 and a 3.
What does that mean, by the way? I don't know what that means.
Well, a probe measures the depth of the periodontal pocket around the tooth. So the deeper the probing, the less healthy the tooth is, or the gums are.
Okay.
And so normally, 2s and 3s are considered very healthy. Well, I'm seeing patients that are probing 6s, 7s, 10s.
Okay, so these are pockets. Okay, so the gums, when you have gum disease, you get these spaces in and around the gums.
Yes, caused by bacteria.
And they're pockets.
In their pockets.
And these 8 millimeter or whatever, that these are normally had to be taken care of with surgery.
That's correct.
And then the gums get close to the teeth again? Is that
Yes.
right? So the laser does what then?
Well, the laser goes down underneath the pocket, or into the pocket. It's ablating the bacteria. It's killing the bacteria that are living not only on the root surface, but also in the lining of the tissue, as well as the top layers of the bone. And that's really the beauty of the laser. It's killing bacteria that are living in these privileged sites that we can't get to through normal periodontal therapy, like scaling and root planing, or typical gum surgery, bone surgery.
If it's as good as you say it is, why aren't all doctors using a laser to do this? Is it the expense of the laser? Is it they don't believe it? What is it?
I think there's some of it that is the expense, and there's some that we just really, periodontists in general, like to cut. It's hard to change old habits. They've been cutting for years, and it's hard to learn a new technique and to really put the time and energy into learning more about the laser.
But this is about overall health as well. I mean, this is a chronic infection in the mouth,
yes,
right?
Yes.
Laser kills that chronic infection. It's got to be good.
It's wonderful. It's amazing.
And you say you give your patients, and I want to quote you, laser love.
Yes, yes.
What does that mean?
Well, the laser, I use the laser for different things as well. Not only do I treat periodontal disease, but I use the laser to treat muscular problems caused by temporomandibular joint problems. So I had a young woman, just last week, who called me up in excruciating pain, and she felt that she couldn't go to work the next day, and she was not sleeping.
Like what kind of pain? I mean, pain from
Well,
what?
pain from her jaw. She grinds her teeth and clenches her teeth. And so she forgot to wear her night guard for 2 nights because she was away. And so anyways, I said, well, why don't you come in at the end of the day, which she did. I treated her with a little laser love. And the next day, she called and she told my assistant that she felt 1,000,000 times better and could not thank me enough.
Okay.
Yeah.
Now, let's talk a little bit about, because you've made statements to me on the telephone, like we're changing people's lives. How so?
So I have a patient that came in. He was ashamed of his smile. He had bleeding gums, puffy gums. His teeth were starting to shift because of the disease. He also had some crowded teeth that he couldn't clean well, and that was making the disease worse.
Okay.
So when we looked at his mouth, we could see that the bacteria had caused bone loss. So by treating him with a laser, we were able to tighten up the gum tissue, kill all that bacteria, tighten up the gum tissue, so now it's a nice light pink color. Now when he brushes and flosses, he's not bleeding. He doesn't have bad breath anymore. Now he wanted to take care of his crowded teeth. So we're just finishing up with Invisalign, and he's a remarkable patient. He's already asking me what we can do next after the Invisalign. We're going to either bleach his teeth or do veneers or a combination of both.
So people with bad gums, that they just say, I have bad gums. So I can't get veneers or I can't get dental implants. You're saying, though, that this infection, the laser will go in, target. How does it work, by the way? How does it kill gum disease? Is it the heat? What is it?
Well, it's the laser energy. It's actually the wavelength of the laser beam that's killing the bacteria. This laser, this particular wavelength of the laser that I'm using, is attracted to dark, pigmented bacteria, the type of bacteria that cause gum disease. So the laser gets underneath into the pocket and kills the bacteria that are causing this disease. So I have another patient. a woman in her early 50s who came in with puffy, puffy gums, all bacteria underneath the gum tissue, hardened tartar buildup underneath the gum tissue. And she thought that I couldn't take care of her. She said, I want to save my teeth, but I don't know how you're going to be able to do this. And I said, with the laser, we can definitely accomplish that. And so I treated her very successfully. Her gum tissue healed up beautifully. We were now able to save her teeth.
So her options, had she walked into another periodontist possibly, they would have had to cut or do surgery?
They would have had
Is that true?
cut, yes, absolutely. They would have had to cut her gum tissue away. They were so inflamed.
But going into this, periodontist friend of mine, and I say this respectfully, says, but Randy, traditional therapy works. Traditional surgery, cutting out the disease, works. What is your response to that?
Well, it does work. We've been doing it for years and very successfully. The problem is that if we cut out the gum tissue, we're still leaving behind lots of bacteria that are living inside the walls of the gum tissue.
Okay.
So we're
Could
not,
anybody disagree with that? What
no,
you just said?
nobody could disagree with that.
Okay.
So it comes back. We never really cure periodontal disease. We're just trying to get it under control. So with traditional surgery, if we cut it out, we're still leaving lots of bacteria behind that continue to cause the disease. It can get into the bloodstream. With the laser, we're zapping all of that bacteria and to allow the patient's own body to heal. So they both work. I just think that one works better.
Is there any science behind what you're saying, by the way?
Absolutely. There's all sorts of histological...
I mean, published
yes,
literature?
yes, showing that we're not only growing bone, but getting new attachment.
Okay, so you make the... So you're killing the chronic infection.
Yeah.
I mean, logically, this makes sense to me. How could your colleagues not agree with this? And I'm not trying to side with you, but if what you're saying is true, it seems like a logical thing to do, to go in, look for a laser dentist.
Absolutely, yes.
Is it laser dentistry?
Yes, laser dentistry.
Do you use a laser for anything else, by the way, that we haven't mentioned?
Well, I use it for cutting, for sculpting gum tissue.
Okay.
And I also use it for my laser love when I'm treating some temporomandibular joint problems.
So is it more women than men that are coming in?
Well, usually the women will come in first. Men are usually, they wait too long because they're afraid to come in. Their wives are dragging them in.
Is that right?
Yes, absolutely.
Like why? Why would the...
Well, they know that their husband has bleeding gums. They know that they have bad breath. And they also are afraid that they're transferring the bacteria back and forth.
Is that possible, though?
Yes.
Is that a valid worry?
It absolutely is. Periodontal disease is contagious. So by kissing, you can contaminate your partner.
So if you have a bloody mouth, obviously, inside,
Yeah.
that is going to be transferred.
Well, the
Interesting.
bacteria is going to be transferred to your significant other.
What motivates people the most to get this done? Because people don't want to go to the dentist. They have bleeding gums, puffy gums. And just to make it clear, you're saying they're headed for tooth loss. I mean, that's the number one reason why people lose their teeth is gum disease.
That's correct.
And I don't want to put words in your mouth, but it sounds like it's a pretty easy fix if caught early.
If caught
bleeding
early.
Gums, puffy gums, you go in there with a laser, kills this chronic infection, the gum gets better, the teeth get stronger.
Yes.
That's not, do I have it
It's
right?
easy. If you treat it early, it's very, very easy. If you wait too long, we can't save all teeth. If you wait too long, there's going to be more bone loss and more of a risk of losing those teeth. But if treated early, we can certainly save a lot of teeth.
But the main thing is it's more than teeth. I mean, like you told me on the phone, it's about a smile that you've always wanted. How important is a smile in your opinion?
Well, you know, a smile is how you present yourself to the world. So I have another story. One of my husband's patients, who's a sports newscaster, never smiled on the camera, and he was very self-conscious about his teeth. So my husband did a reconstruction of his teeth and remade his smile, and now he can't stop smiling. He's
So you see people smiling more?
oh yeah, yeah. They're not covering their mouth while they're speaking. They're not looking away. They're feeling healthier and stronger, physically even. They feel better. They come in saying that they feel better, healthier.
Why do you think that is?
Well, I think that we're removing a bacterial infection that is infecting their whole body. I think that they're feeling healthier because they can now chew better. They can eat better. They have more energy because their body's not trying to fight this bacterial infection in their mouth, in their gums. So they just overall feel healthier.
Nobody wants to lose their teeth. And you're saying that the number one reason why people lose their teeth is gum disease.
Yes, that's true.
Of the, you mentioned earlier, like 20 million plus denture wearers, upper lower denture, how many of those do you think could still have their teeth if the laser technology was brought in early?
I think the majority of them could
like
have.
Majority, like what,
Yeah.
90%? I mean, this is your
I'd say
opinion.
90%. 90%.
Really?
Mm-hmm. Mm-hmm.
Is that the future of dentistry, by the way?
Absolutely it is. Lasers are here to stay. It's a remarkable, remarkable tool that we now have.
But the future of dentistry, when you go in, you get a cleaning, do you think the future will be you go around the mouth, the hygienist may go around the
In some
mouth?
states, they're doing that now. That's
Really?
not legal in Pennsylvania yet, but the lasers are being used all the time at hygiene visits. Yes, it's definitely the future of dentistry.
And so, final message, somebody, and if we're just tuning in, we're talking about laser dentistry. Give me the symptoms one more time. Okay, so loose teeth.
Loose teeth.
Teeth that are all of a sudden starting to shift for no
Shifting
reason.
teeth, bleeding when brushing or flossing, a bad taste in your mouth. All these are signs of gum disease, receding gum tissue.
So take me through the process. Okay, so somebody watching this, they have those symptoms. The bleeding gums, bad breath, puffy gums. You say they're headed, you don't say it, I'm saying it, they're headed for disaster.
Yes, they are.
Is that right?
Yes.
They're going to lose their teeth?
They're going to lose their teeth ultimately.
Okay, so what does the consult look like? So they go in on day one, what happens? They meet with you?
They would come into the office and we would take some radiographs to be able to see what their teeth look like. So we go around and we take measurements around the tooth, and we know if they have bleeding gums and the probe is going into these pockets.
So you call them pockets?
Yes.
And they have measurements?
Yes, and a pocket is something that it's, at one point the gum tissue should be attached tightly to the tooth.
All right.
And so when they have gum disease and this bacteria is getting into this little space, causing the infection to progress. And as that's progressing, the patient's also losing bone that's supporting the tooth. So by measuring around the tooth, I get a good sense of how severe their disease is.
Now, when you look at it, by the way, do you say this is going to be easy? I mean, do you have those kind of instincts?
Oh, absolutely. And I have a good idea of what teeth we can save and what teeth we can't save. And we can't save all teeth, but we can sure save a lot of them.
Okay, so you look at that. So this is on day one. You sit with the patient and you tell them, okay, this is the game plan.
Well, I give them their options. Of course, I always go through all the options, even the old-fashioned way of treating gum disease.
You give them that option?
I give them that option because they need to know all of their options so that they can make an informed decision.
And how do you say that? I mean, we could either cut it out surgically.
Yeah. We can either cut it out, we can either do the scaling and root planing.
Scaling and root planing is what? You've mentioned that a few
Scaling
times.
and root planing is, you may have heard it called a deep cleaning.
Okay.
It's taking little tiny instruments and going around the tooth to remove the bacteria and
So you're
the
like
buildup
scraping
there.
the teeth.
Like scraping the teeth.
Okay.
And early on, you can do that if the pockets aren't of any great depth.
Right.
But as the pocketing and the disease advances, you can't just do the scaling and root planing. So you need to either cut out that disease or laser out the disease.
And well, it sounds like everybody would go. I mean, does anybody ever say, hey, I want the surgery?
I haven't
Obviously not.
had anybody want to do traditional surgery since I've had the laser.
But there are thousands of periodontists that are still doing it the old way, treating gum disease by cutting it out rather than lasering it out.
That's correct.
What is their hesitation?
Well, it could be the cost. That could be one factor.
The cost of the laser.
The cost of the laser. Another factor is they like what they're doing and they don't want to learn about the laser.
What do you say to them? Because dentists will watch this show. What do you say to them about
I say
effective
that they
this
should
is?
do a little research, find out some more information about the laser, and look at the histological evidence showing that we're actually...
it works?
It works. It works.
How has it changed your job, by the way?
Well, it's made my job a lot easier. It's a lot easier for me to present the laser treatment to a patient than to present traditional surgery to a patient. Patients can sense that I believe in it so much, and I tell them about the results that I have seen. They think that why wouldn't they want to do that?
Okay, so once it's determined you're going to do the laser, then what? Then how many times is your office?
2 visits to be treated with the laser, and then there's some post-op visits where I check on them, and then they really just need to maintain their normal hygiene regimen, coming in to see the dental hygienist for cleanings.
So you go around the mouth with the laser, kill the bacteria, and you treat the whole mouth over 2 visits?
Over 2 visits, yes.
Over 2 visits?
That's correct.
Is it true that, and I've talked to some dentists, they say that the problem with treating gum disease in the past was you would do one side of the mouth with surgery, stitch it up, and the people don't want to come back for the rest of the mouth.
That's right. You actually wouldn't do one side. You do one quarter of the mouth.
So one quadrant.
One quadrant.
Okay.
Exactly. One quadrant at a time.
Is that
and
true though? They don't want to come back because it's so painful?
They don't want to come back. You know, now they have exposed root surfaces, sensitive teeth, and you know, to hot and cold.
The surgical.
Doing surgical
So they say,
treatment.
I'm not coming back.
I'm not coming back for this.
So one side of their mouth is done.
Mm-hmm. And they don't want to come back.
And when you bought this laser, did you call all your people that?
Oh, well, I had one patient in mind that, you know, I treated him, you know, a year prior to this. I did all four sides, all four quadrants of his mouth. And everything looked great. And in about a year later, the pockets, the disease came back. So I said, you're coming back in. I'm going to retreat you. I treated him with the laser. After I did the first side, he felt so good. When he sat in the chair the next week, he could not wait to get started. He felt incredible. He just could tell.
Didn't you say somebody was begging you for treatment?
He was the one that was begging me for treatment.
In the green room, I said, I don't know if I believe that.
Uh-huh.
So
he was
what did
actually,
he say?
he just was like, I can't wait, let's get started, let's do it. He's all ready.
So bad breath goes away, the bleeding stops, the teeth get stronger.
Sensitivity goes away.
Hot and cold sensitivity goes
Yes.
away. And what's making it sensitive? I mean, how does the laser, because a lot of people have hot and cold sensitivity.
Well, the laser's affecting the root surface. So not only is it killing the bacteria, but somehow it's changing the root surface so that the teeth aren't as sensitive to hot and cold.
So in this economy, why do something about your gums? And this is off topic, but I want to hear your take on this.
Well, Randy,
because insurance doesn't cover this.
No. Well, sometimes it does. Sometimes it does.
Parts of it. Okay.
But in this economy, when so many people are out of work, you have people that are going on job interviews. So if they're at a job interview and they're meeting with a future employer, and they're smiling and they're being judged by their smile and they have red, puffy gums, they're not, you know, and you have two different people interviewing for a job of the same educational background. So who are they going to hire? The one smiling or the one not smiling?
That's a good point.
Yeah.
I mean, obviously you hire the person that looks happy,
right, that's
motivated,
confident,
things like that. Because you even said to me on the phone, and I didn't quite get, that it's more than just gums. Elaborate on that.
Well, it's more than just gums. It's the way that you present yourself. If you're self-conscious about your breath, you're going to stand back and not be who you really are. You're going to be a little bit more intimidated. When you have healthy gums and you don't have bad breath because the disease has been taken care of, you can present yourself in a way that is more presentable.
Okay. Who should get, and by the way, if you're just tuning in, we're talking about laser therapy for people with gum disease. And by the way, do the patients call it periodontal disease or gum disease? Is that the same thing, by the way?
It's the same thing. Most patients call it gum disease.
Okay. And do they know they have gum disease?
Oftentimes not. They don't know. A lot of times in a smoker, it's masked. The redness, the puffiness is not there because the smoke is dehydrating the gum tissues. So a lot of patients don't know that they have gum disease. It's painless. So they don't really know that they have it sometimes until the later stages.
And then they lose their teeth.
And then they can lose their teeth.
And so the downtime, are people missing work over this? Are they complaining about pain the next day? Tell me about that.
Well, there's no downtime. I mean, usually the day of the surgery, I tell my patients to take it easy. I want to pamper them a little bit. They can go back to work the next day, do all the activities that they're used to doing. So there's not really any downtime. There's virtually no pain. Patients are surprised how comfortable they feel the next day after the surgery.
Okay, so knowing what you know now, as a periodontist, could you ever go back to the other way? If they take away your laser, what happens?
I'd be lost. I'd be lost. I'd have to retire.
Really?
Yes.
I mean, if you had to just do surgeries all day, you wouldn't want to do it.
Well, I still love surgeries, but I just know it's not the best thing for the patient. So I couldn't go back.
Now, some guys are busier than others. I've interviewed some other people about gum disease. If people knew, I mean, would you say there's tens of thousands of people in your, maybe not neighborhood, but within 20 minutes
yes.
that have bleeding gums, puffy gums, things like that, early stages that would be easy for you to take care of?
Absolutely.
So what do you say to them watching this?
Come to my office, let me take a look, learn about all of your options, and then decide what's going to be best for you.
What are the age ranges of the patients that come in with bleeding gums, gum disease, things
Well,
like
usually
that?
I see patients, baby boomers have a lot of gum disease, but I also see patients in their early 30s, surprisingly, and even older patients who now really want to not only take care of their gums, they're afraid that it's affecting their overall health. So they also want to be treated.
So when you see, I mean, could people have beautiful white teeth and have gum disease?
Yes, absolutely they can. And they won't even know that they have disease, but they'll complain about bleeding. And they'll have these beautiful new veneers, but their gums are bleeding. They have disease. And
so all they have to do is go to your office and you go around, maybe I'm oversimplifying
Yes,
it, but
just
you
a
are
little,
going around the
with
mouth
laser.
with a laser.
Yes.
And so even if you have veneers, you kill the bacteria.
Oh yeah, absolutely, underneath the gum tissue, certainly.
Now, we haven't even talked about this whole heart disease, diabetes connection. A few seconds on that?
Sure.
What's the connection as you see it?
Well, periodontal disease is a chronic inflammatory disease. So it affects these your body's trying to heal this disease. So it's putting your body under more stress. And they also know that the same bacteria that are found in the mouth are also found in the plaques in the arteries.
Okay, great info. And so if they want to find out more, they can visit your website.
Yes, please do.
Learn more there. And your office is located where?
Well, we're
new office, fairly new office.
at the Navy Yard in Philadelphia.
All right. Now, are you from Philadelphia, by the way?
No, I'm from Connecticut.
Okay. And when did you know you wanted to be a dentist? Because you don't look like a dentist to me, by the way, especially a specialist.
Well, I was a dental hygienist for many years in Connecticut, and I just felt like I wanted to do more for my patients. So I ended up coming down to Philadelphia, went to University of Pennsylvania to receive my dental degree.
So you were a hygienist first?
Yes, I was.
How does that make you better as a dentist?
Well,
or does it?
Well, I can't say that it makes me better, but I'm grateful. I'm happy that I have that training because I really focus on the gum tissue and overall periodontal health before taking care of any other aspect of dentistry.
Okay, good. I want to thank you for coming on the show.
Okay.
Very interesting.
All right. Thank you so much.
It's a pleasure.
Thank you. My pleasure.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to find out more about the laser or more about Dr. Milici, you could go to our website at wellnesshour.com. Just put in Dr. Milici, or you could put in Philadelphia periodontist, and you'll find her there. Also, for those of you that would like to mention this on Twitter, you can put hashtag The Wellness Hour and make a comment. Say something nice about Dr. Milici. For now, I wish you good health.